Good afternoon, everybody. My name is Rohan Prasad. I'm the Director of Partnerships here in Sydney for SciSense in Australia. It's my pleasure to welcome everybody to this session. I'll be the moderator and host for today's talk. Just a few housekeeping items. This session is being recorded and will be available to you afterwards. If you have any questions, just use the chat box or raise your hand and we'll be able to catch that. There will be 10 minutes at the end of the session for questions, but again, just feel free to jump in and ask as we get going. All right, let's get started. So it's my pleasure to introduce you to Ian Tebbutt from Rapid BI. Ian is a 20-year health data veteran, most notably working at Health Roundtable, right? So curating data for their successful benchmarking program. He was also the data lead for the successful dementia care in hospital program, which looked at the handoff between aged care and hospitals. You know, with the Aged Care Commission recommendations out, some people say that they've introduced exciting new possibilities for benchmarking and performance improvement. Definitely, there's a lot of interest, a lot of discussion, and Ian's going to be spending the next 15-20 minutes discussing how these requirements can be met and how they can be leveraged within your organization to increase productivity. So let's get started. So Ian, over to you. Thank you very much.
Thank you so much, Rohan, and thanks everyone for joining us today. And many thanks to SciSense for hosting us. My name is Ian Tebbutt. I'm a senior analyst with Rapid BI. And what we'll be talking about today is the Aged Care Royal Commission and specifically what its impact is on data and benchmarking. So the Royal Commission ran for a bit over 2 years and produced its final reports in February 2021, February of this year. Now, it actually identified close to $10 billion of additional funding. So there's money available. But one of the most important things that we have to remember right at the start, though, is that regardless of what the Royal Commission says, regardless of what I'm going to talk about with data and benchmarking, care is care. At the pointy end, whatever anyone writes in a report, it's still down to people looking after our older Australians. And we are not the experts in that. You are. You are the people actually in the audience. We see our role as helping you make aged care better, but you're the experts and we just want to assist. A lovely quote that came from the Grattan Institute though, about the Royal Commission's report. Unfortunately, the Royal Commission did not provide a clear roadmap to a better system. The final report was littered with disagreements between the two commissioners. So clearly all was not rosy in the playhouse. And I think this just shines a little bit of a light on just how complex aged care can be. With many years and much expertise, they still couldn't really agree on what was a great way forward. And Grattan themselves have done a great job of working their way through the recommendations and putting their own ideas on top. But I thought it was interesting to shine a light on that because these things are not easy. But everyone did agree on one thing, and that was the use of data and benchmarking to improve quality care. And that came through, certainly for me as a data professional, that is everywhere in that report, and it's everywhere now in the organisations that you will be dealing with. Now, ELAA, everyone loves an acronym. If you looked at the report or you're working in aged care, I'm sure some of these will be familiar with to you. And I think that first one, the most important, we now have a thing called the National Aged Care Mandatory Quality Indicator Program. And you'll be aware of this because from this month, October 2021, you have to deliver information to the government around pressure injuries, restraints, and unplanned weight loss. So there are 3 areas of quality indicators, also known as QI, and it's mandatory. You have to gather this data and the government will be tracking it. Now, there's also a move towards activity-based funding, much as there was with hospitals, and that activity-based funding is based off an aged care classification. That classification will directly control how much money you receive for your residents. That will be looked after, that classification, by IPA. And IPA I know is the Independent Hospital Pricing Authority, and they've recently renamed to the ICAPA, where they put in aged care as well. So IPA essentially manages the process. IPA controls how much money you get for the various levels of complexity of your residents. And another one I want to drill into just slightly, is Gen and the National Aged Care Data Clearinghouse. So there's actually available online a full set of aged care data, quality indicators and details of every resident, de-identified, but with ages and so on. And what I've done is I've taken that data and I'll show it to you how it works in SciSense. Now, from my experience in health and with hospitals, I want to make a few predictions. As I've said, IPA and the Safety and Quality Commission will link funding to activity. That's pretty much a given, and that's what the report says. But the role of quality indicators in that space is going to be interesting. There will be a little bit of carrot and a stick. The quality indicators, if you're doing well, maybe you'll get some more money. If you're doing poorly, maybe there'll be a penalty of some kind. What happened with hospital care was that was implied, but it's politically very difficult to do. So although it was implied that that would happen, it never actually came to pass. However, the benefit in terms of quality care in Australian hospitals was clear anyway. Because what happened, as in hospitals, these things are called adverse events as opposed to quality indicators. But as people were measuring adverse events, so the rates of adverse events reduced. And I think that's what we'll see with quality indicators as well. Now, I'm sure, as your organisations will be aware, the actual gathering, cleaning, getting the stuff together that you need to send to government can be just a pain. It takes time that you don't really have anyway, because all these places are very busy and you actually want to be delivering care. But you're going to have to do it. In fact, you've started doing it. You should have started this month and probably a long way before that. So if you're going to do this, why not get some benefit from it? I mean, how would your QI numbers compare to the national and state level data? How useful would it be potentially to take this data from Gen that's there and available for everyone to use and see how you are doing? Are you improving in the same way? Now, your current state could look a little bit like this picture on the left. It's a shed full of bits and pieces of, in our terms, data. This data doesn't integrate. It comes from incompatible systems. And getting the data alone is hard enough, let alone actually making some sense of it and then using it for benchmarking. So how could this change? Well, this is where a platform such as SciSense comes in. A BI system which can extract data from all of your incompatible systems. And it blends it together, mixes it up, and then provides some really useful insight. And in fact, you actually don't have to imagine that, because I've created an example, which I'll show you now. So if you look at this table on the right-hand side, this is Gen data straight out of their report. If I click the link, so you see this is online, the Gen Aged Care report running up till June of this year. We have a table for pressure injuries, some numbers, and Gen measures these in per 1,000 care days, and a lower number is better. So if you look at this table here, this is the number of physical restraints used across the whole of Australia per 1,000 care days for just the quarter between April and June of this year. Now, what I've done is taken all of this data, all of the Gen data, and pulled it into SciSense. And this first dashboard probably shows you some information which you'll probably already be familiar with, but it gives me an opportunity to show what does SciSense do. So we have 4 areas on the screen: the map, a column chart, and then 2 quite complicated column charts below. Each of these is a widget, and these widgets are being controlled by filters on the right-hand side. So what we're looking at on this map is the 73 planning regions for the whole of Australia. So these aren't facilities, these are actual planning regions. And these are set up by Gen and so on for their reporting purposes. And you can see between males and females, there are 126,000 females and 64,000 males actually in residential aged care at the moment. So close to 200,000 in total. Interestingly, 2/3 of residential care is female. And I'm sure those of you who work in the field are aware of that. But I think it comes as a bit of a surprise that just how many more women live longer in aged care than men. Let's have a quick look at where our oldest Australians are, the centenarians. So what I've done there, I've selected a filter on the right-hand side, filter down just to show those who are 100 or older. And what that will do is it's updated all the widgets. Immediately you can see that there's 2,000 females, and then another 400 males. So about 2,700 Australians are over 100 and in residential aged care. Females are by far the largest proportion. So women do live longer. And I think so. It's not a startling fact, but it's interesting to see just how much the disparity is in gender at this age. You can still see the dots on the map. These are following the cities, or the major capital cities, with a few older people in rural and regional. And if I look at the bar chart below, you can see there are two main places. There are two: New South Wales, northern Sydney, southeastern Sydney. If I just wanted to drill into those a little bit further, I could easily select, zoom in again, the map will update, and then we can see it's Southern Metro and Eastern Metro and what the percentage of people are there. So just a simple example of how SciSense can work. I think you'll see from this, it's much easier to see this or to use this as a dashboarding tool than what Gen actually provides, which is just a spreadsheet where you'd have to do all this analysis yourself. But to get real value, real benchmarking, real comparison, real improvement in quality care for your organisation, you need to be looking at the quality indicators. And I've chosen restraint devices. And coincidentally, I started with Victoria because that just so happens where Rapid BI is based. Now, if you were eagle-eyed, you might notice something a little bit odd. This number in the middle here, 0.77, so this is how many restraint devices are used in Victoria in the quarter that started in April 2021. That's very different to this number here, which is straight from the report, 2.92. 0.77. Is that data incorrect? Maybe if I looked at the trend. I looked at the trend over all the months. Maybe there's some historic data there which is getting included in that 2.92 figure. Well, I can immediately see from here, no, I mean, the numbers at 0.76 aren't too bad. They started out 2 years ago at 0.7 or so. I see an interesting effect. I mean, the amount or the use of restraints went up slightly into early 2020. Now, I see this as a complete result of COVID. The number of staff available, especially in Victoria, went down. So just the use of restraints naturally went up slightly. But it still doesn't really explain why that larger number is there in the Gen report. So maybe it comes from other states. So let's compare Victoria and New South Wales. Now we're getting into some interesting insight. So you can see the actual amount of use of restraints in Victoria is very much lower than New South Wales, which was quite a surprise to me. There are some really positive things here, though. You can see the trend from New South Wales is going down. Only 2 years ago, they were rating around a 5 per 1,000 days. They're already down to 3 per 1,000 days. So that's quite a major improvement. And I think this speaks to when you start measuring something, you tend to get an improvement. So the mandatory quality indicators are already having the impact, the positive impact that the Aged Care Royal Commission wanted. But it's still, let's see, how they handle it in other states. Is Victoria the anomaly? Turns out it is. So Victoria's figures, are ranging between the 0.6s, 0.7, 0.8s. Queensland is a whole 10 times larger. They're all showing trends down. So Queensland is trending down, New South Wales is trending down, ACT. We're all seeing a little bit of a bump early 2020, which I'm sure is a COVID effect, and that's quite interesting that it comes out in the data that the amount of restraints are being used. But I think just this alone speaks to the way in which you present data is so important. All of this information is available on the Gen site, but they haven't made it available to show a trend, and they haven't done the comparison between the various states you can see. There's clearly something very different about the way in which different organisations in different states are running this, and this is an area which could be investigated, and that's kind of at the heart of benchmarking. But this is at the state level. The real value of benchmarking is when it comes right close to home, right with your data. What could you change? Where are you going? So I'm just going to make a quick change. Imagine, if you will, there's an aged care organisation called RB Aged Care. At the moment, I've set this filter to show data from Gen. I'm now going to turn on the filter so I can show RB Aged Care, RB being Rapid BI. So what I did is I created an imaginary aged care facility. I gathered their data, and now I can put it onto this particular chart, and we can get some insight. So the RB restraint devices, tracking very closely with the restraint devices for the whole of Victoria, doing slightly better earlier in the year, earlier 2 years ago, then having this same COVID effect, essentially hitting exactly the same, pretty much exactly the same level as the whole of Victoria, but not worse than Victoria, always doing slightly better and then improving in the same way. So if this was a real facility, you could look at those numbers quite quickly and say, yeah, although we've landed slightly worse now than we were 2 years ago, compared to the whole rest of the state, we're not doing too bad. We're tracking in a similar kind of way, and occasionally, we're doing better. I think that's a positive result. There's room for improvement, but you're not doing too badly at the moment. I think, so this speaks to how valuable benchmarking can potentially be. Imagine a situation where that data was your data. As I start out with, I'd like to think of this as an Oprah moment. Those Gen dashboards, ones built from that publicly available data, they'll be available for all, and we'll share out the URL. But what we'd love to do is actually put your data into those dashboards and do that benchmarking that we've just done, but do it for real, do it with real QI data from your facility. So everyone gets a dashboard. If you would like to do that, we will do it for free. And yes, it will be private. So you don't have to take this on trust. We'll build you an example, we'll use your QI data, we'll benchmark your performance, and we'll do it all for free. The only thing that we ask from you is we carry on the conversation. We want to be helpful, we want to know what your problems are, and we want to know how data can help you. And then go over what we've been talking about. You've got to gather these quality indicators, so why not get some benefit? And benchmarking is the best way to monitor and improve anything, not just aged care. And I saw that very strongly from my experience in Australian hospitals. So how will SciSense fit into that picture? Well, SciSense is great in that it can be integrated seamlessly. We can take data from anywhere, and we have experience of a huge range of systems. So we're totally confident we can gather data from your software systems, which may be in all kinds of different formats. There's no particular restriction whether you can run in the cloud or on-premise, or if it has to be Azure cloud or AWS cloud. We can support all of these out of the box, no problem. It also has its own super fast data store. Not the most interesting thing, maybe. Apart from it saves you money. There's no reason for other add-ons or bolt-ons, or this is just a dashboarding product, or this is just a data product. It does everything in one seamless system. And one of the things when you're rolling out a new, especially reporting system, is how much use will my staff make of it? How easy is it for them to use? I think the best example of that is our experience at St Andrews in Adelaide. They built their own benchmarking dashboard system with virtually no training and no change in staff. We got them going, and they just ran with the project, and now 2 years later, they absolutely love it, and we very rarely speak to them because they're running all their own infrastructure. If you need to take data back out of SciSense, now we've spent the effort to get it in, yes, you can output to Excel or any other format so you can do your own analysis. And I think this is crucial right at the end, especially for those who are providing software products or already have their own systems. Embedding SciSense is one of its real strengths. Over half of SciSense's customers use it in the embedded mode. And what that means is your software and SciSense blend seamlessly together. It actually becomes an integral part of your software. It looks the same, the branding will be the same where it appears within a browser screen. There's no need to leave your existing application and then go to BI and then do some analysis and then come back. It's all in the one place. So it's fantastic. There's very little need to train. People have the tools that they need straight to hand. I've spoken a fair bit about SciSense and a lot about aged care. And now I'd just like to round up by talking about who Rapid BI are. We've got deep experience in benchmarking, especially in the health marketplace. We've wrangled every kind of data you can imagine. So anything you have, we're sure that we'll be able to process and get into SciSense. And naturally, we're a BI consultancy. We were the first accredited SciSense reseller in Australia. We can do all kinds of dashboard and visualization work. And of course, we can also help with SciSense licensing. So we're now at the end, and thank you very much for your time.
Thank you. And that was a very, very interesting discussion on aged care and how benchmarking can really drive value. Team, thank you very much for attending this session today. We're going to stop there. A copy of this presentation will be made available to everybody, as well as Ian's contact details in case you'd like to take them up on the offer to have that benchmarking done with Rapid BI. So thank you very much, everybody, and have a great day.